Welcome everyone. We're here with Dr. Orlando Nunez and myself. We have a young patient, everyone's young in our office, who has presented today for correction of bilateral left and right, correction of the bunion deformities as well as the hammer toe deformities, left second, right second. Let's take a quick peek. So looking at the left, this is a really striking bunion deformity. We see these quite a bit. This is just absolutely monumental. Okay, this maybe gives the public a better idea of the sheer size, and I think the video doesn't even do justice to the size. Now, once we correct the bunion to the normal anatomical position, then we're going to go ahead and bring the second toe around again back to its normal anatomical position. And of course, we're gonna definitely do an after. Looking at the right, same exact thing. I mean, this has to, this is years of pain. Can you imagine trying to fit this into a shoe? Think about that for a second. So again, we're gonna correct the bunion, bring the second toe around. When we talk about transformations, ladies and gentlemen, this is gonna be an unbelievable one, and I'm talking with true passion now. This is the wonderful things that we do as foot and ankle surgeons. Stand by, everyone.
Okay, everyone, so we're all done with both procedures, left and right. On the left, again, just to refresh everyone's memory, we corrected the bunion deformity on the left, also the left second digit hammer toe deformity. We also did the right. I just want to show everyone just exactly the before and the after, okay? So the bump is gone, as everyone can see, okay? We have one little suture here. We corrected the hammer toe. It's perfectly, we're gonna go ahead and bandage it right here, but it's perfectly aligned, as everyone can see. The reason why I'm holding this here is because the patient had such a large deformity, right? And now it's basically like you see? I want everyone to take a look here. This is really important for everyone to see. At first glance, people may think, oh my God, well, wait a second. It looks like the bone is still there. And that's not the case. The patient has had this bunion for how many years now? 20, 25 years?
30 maybe.
30 years. So 30 years later, today, almost 2020, all that redundant skin, right, will slowly resorb. But, what I really wanted everyone to see is basically that, right? This is what eventually, it's obviously it's a little bit, there's a little bit of swelling here, but from this side, right, the toe, everything's going to look like this. That's the end result. Absolutely beautiful. It will take a couple of months for all of this swelling to
the little thing on top is
to subside. Give me one second. So that's what it basically, what it's going to look like. We corrected the hammer toe through right here. There's one little stitch on the bottom. There's one little suture here and one here. And that's it. We're going to put a little steri strip here, but basically that's what it's going to look like. So, it's a huge transformation, which is not only a huge transformation, more importantly at the core, outcomes, right? That's what we focus our efforts on, the outcome. So, okay, much better. So, the most important thing is, this is sort of like the easy part. The hard part is everything that happens afterwards. The commitment from, the patient. We're very keen on patient selection, which is very, very important. We have very, very good patients, and there are maybe not such great patients. And believe it or not, we've had to push patients away because of this reason. this is our canvas, so to speak, right? And whatever we do here, after the patient walks out, we have no control over. So it's really, really important for patients to understand that this is not just a walk in the park. This is a very, very big investment that patients make, right? Physically, emotionally. And these are the things that that people don't really think about. They see these wonderful before and after pictures. Oh wow, right? And this is everything in between they don't see, and that's the 90%, right? 10% what happens here, the 90% everything that happens after they leave here. And the patient will be seeing us for several weeks to come. This is not a walk in the park, ladies and gentlemen. This is a huge commitment. Patient more than anything, more than anyone. This has to come, and they really, need to be an integral part to make this a huge success, and make sure more than anything that they follow all the instructions. For all of the world to, what do I want to say to the world? This is an investment. Minimally invasive doesn't mean that it's a walk in the park at all, right? Whether it's open, traditional, minimally invasive, it's a different approach that we offer our patients. But I think that at the core, the most important thing is that patients understand, that everyone out there understands that yes, there are pros and benefits to minimally invasive surgery, such as what we're here in our office-based surgical suite, number 1, number 2, recovery number 3, obviously the little stitches instead of a larger incision, and I can go on and on and on, right?